But welcome and thank you for coming to our webinar. This month, we're focusing on micronutrient deficiencies and disease and why they matter in functional medicine. So I think this is going to be a really great kind of back to the basics webinar that Dr. Brent Agan is going to share with us. And if you've been on our previous webinars, you know a little bit about him, but I'll let him present himself and present our presentation, and then we'll go to questions and answers.
All right, perfect. We will get started here. The slides go. So just real quick about myself, for those that haven't met me, this has been my passion my whole career. I have not practiced in a traditional medicine setting ever, which I'm happy about. But it's important that you know who you're getting your information from. So I've spent my whole career studying and practicing and continue to practice still a few days a week. So I still have an active functional medicine practice, about 50% functional medicine. The rest is psychedelic medicine. I think we'll be talking about that next month. But so this is I owned a compounding pharmacy for 6.5 years. I have done a lot with micronutrients in my career, and so I'm excited to talk a little bit about hopefully reinvigorating everybody into the importance of them. But definitely spent a lot of time, especially early in my career, focusing on the benefits and the needs of micronutrients. And so down at the bottom it says, aging is inevitable, decline is optional. You're going to find soon that chronic disease is preventable, and it starts with micronutrients. So let's go to the next one here. All right. So just getting into it, a little bit of opening discussion. When I was doing the last webinar, I was really excited to bring up micronutrients, and that's because, I think in the era we are in, we can get pulled away from social media, from influencers, and just kind of get pulled towards these, new exciting therapies, bells and whistles, shiny balls, and sometimes we lose track of the basics. And I'm not saying that I completely lost track of it, but I definitely would say I am guilty in the fact that both myself and my office have not stopped pushing micronutrient correction, but we definitely have slacked. Once we started talking about it, and then, obviously once you get deep into it, you realize that we don't have the opportunity to stop. And, I think at the beginning of our careers, at least my career, I mean, we were heavily reliant on micronutrients, and understandably, we had great clinical outcomes and we had a good financially solid practice. We didn't have some of these therapies. The peptide industry was just growing. HRT and TRT was shunned upon back there from 2002 until just recently. So we had our functional medicine was rooted with micronutrients, and it worked really, really well. So hopefully we can bring back some of that excitement and also kind of paint the picture of why it's so important, not for just what micronutrients do, but also how they support some of these new and advanced therapies. So that's really exciting. I know, because the rise of disease is not predictable. I mean, we've watched the trajectory of chronic illness happen, and we've just kind of, I guess, swept it under the rug as far as maybe what would be causing it. But we've watched over the decades the changes in our food, the changes in our soil, the changes in the processing, the changes in our lifestyles, the increase in pharmaceutical prescribing, the addition of blue lights, everything has been changing and moving towards this whole concept of micronutrient deficiency. They've been walking us down this path, and as we sit there and look at chronic illness on the rise in pretty much every area, we shouldn't be surprised that micronutrients are at the root, because we've been watching it happen. We talk about it in our office all the time about the poor quality of the foods, and why we are where we're at. And then we look at with some of these advances coming out, and some of them are actually fueling the problem. So it's exciting that we can talk about it, but we're going to run through this and then really focus at the end on treatments and the type of clients that we're seeing, what our options are for the different therapies that we can provide, and then answer some and have some question and answers because some of the I mean, you can get so deep into micronutrients, but I want to stay a little bit superficial. So the micronutrients we're predominantly talking about are vitamins and minerals. Out of the 90 essential nutrients, this is still the predominant number of them. These are the ones that are kind of drive all of cellular health, and so that's what we're focusing on now. But there's a lot of close substrates that kind of follow the same importance as micronutrients, but these are the ones we're talking about today. Really quick on the micronutrient snub, what I mean by that is why, if they're so important, does nobody talk about them? Does nobody research them? Why are they not talked about by our traditional primary care doctors or our subspecialists? Why is no one talking about micronutrients? And I think we can all understand why that is. And that is because we cannot monetize it. Our society can't. So, medicine was not set up for us to cure disease, to cure chronic illness. Our labs, which we will talk about, labs were not created for functional medicine providers. They're really made to treat disease and use pharmaceuticals. They actually can hinder functional medicine in a lot of different ways, which we'll discuss. But this isn't the snub is intentional. It's not that micronutrients are ineffective. They're not appreciated. And the mission of traditional medicine is very different than functional medicine. So this snub is going to continue to happen regardless of what we discuss and what we understand. And the testing's not going to change. So the environment that we're in under traditional healthcare, we can only hope that some things will be different, but we have to assume that they're not going to change. So just realize this micronutrient snub, and it's really a functional medicine snub. It's just not micronutrients. As you understand, HRT is just finally, after 2 decades of being snubbed, it's finally coming back. But when we talk about peptide therapy, micronutrients, macronutrients, hormones, we're still going to be, fighting a little against traditional medicine. So, but just so you guys understand that the research is there, you just have to dig and find it. It's not going to be thrown in your face, and it's not going to be provided for you as solutions because, again, chronic illness runs traditional healthcare, and it's not going to change. So nutrient sufficiency is the foundation of cellular health. So understanding that is going to set the stage for the rest of these slides so we can get into how we can actively and correctly change the deficiencies. And so when you start with making macronutrients biologically effective, you have to understand when we're talking about macronutrients, fat, proteins, and carbohydrates, they're energy for our bodies. They're the parts for creating our cellular structure. They're there for managing the body, but they don't do anything without micronutrients. So without the macronutrients are biologically ineffective or inert. So the micronutrients, again, are the most important part for even making the macronutrients effective. So we can't ignore the macronutrients, but remember that's one that we can easily get in. There's a thing called hidden hunger, which I'll talk about, which is where we're eating a lot of food, but we're not getting the right micronutrients. And so it doesn't matter how many calories we can take in. If it's not nutrient dense, we're still going to end up with the same problem. So when we talk about ATP production is micronutrient dependent. That's mitochondria. I believe that micronutrient deficiency and mitochondrial dysfunction is the cause of all disease. And by the end of this, you should probably agree with me. But it starts with micronutrients because the mitochondria, the powerhouses in our cells, require zinc, they require B vitamins, they require CoQ10. These are things that if deficient, the mitochondria start to become dysfunctional. And as the mitochondria becomes dysfunction, that's where you start seeing this silent disease where our bodies start to compensate for mitochondrial dysregulation, and they will start taking nutrients and moving nutrients and changing hormonal pathways just to keep the body functioning. And they call it silent deficiency because we don't even know that's happening. But once the mitochondria start to shut down, as you can imagine, it's supply and demand. If you're in an energy abundance, the body runs well. If you're in an energy deficit, it's going to start affecting how our bodies are at a cellular level, how our bodies operate. And most of the time, it starts with immune dysfunction. and inflammation. So mitochondria are completely micronutrient dependent and are what runs basically everything in our body. So when you say deficiencies increase oxidative stress, remember, when we're trying to stop free radicals and we're trying to get rid of waste, we have detoxification and oxidative stress that can develop. And so when our bodies are doing what it's supposed to do, either through detoxification or neutralizing oxidative stress or free radicals, the more and more inflamed we are, the more and more exposures and disease we have, and the less micronutrients we have, you can see it quickly becomes a backup. We start not being able to get rid of oxidative stress. We start getting inflammation buildup, and inflammation continues to use all of our micronutrients and our mitochondrial output of ATP, and it just makes this whole process become worse and worse and worse. And you come in this vicious cycle, and you get this downward spiral of health. And when you talk about advanced therapies, when we're talking about hormone therapies, peptide therapies, these therapies underperform in a micronutrient or a microdeficient scenario. And this happens all the time. And again, which was why I was very excited to have this conversation, was because we know these things. Vitamin D is essential for testosterone. Zinc is responsible for sexual function. Various methylation pathways for thyroids, and we're going to talk about these, but all of these different therapies that we're trying to use before correcting micronutrients are going to underperform in a deficient state. So let's go into the next one here. So with that being said, modern disease is a disease of depletion. So chronic disease has paralleled. As I said, this trajectory has been very obvious for decades, and we've watched this even since I've been in functional medicine. I've watched disease rise, and it doesn't matter what therapies we bring out, disease has continued to go up in almost all categories. So we have to understand that when we can see the different pathways for nutrient depletion, we can understand why disease is continuing to rise as well. And that silent deficiency phenomenon is really where we come in on the lab testing and the treatments and the discussions on how we can remove the silent deficiency, because this phenomenon is basically, as I discussed, it's where we start getting micronutrient deficiencies, and before there's even any signs of disease or symptoms, the problem in cellular health and cellular metabolism has already occurred. We've already had disruption in mitochondria. We've already had disruption in certain hormone pathways. Hormones are starting to shift. And in silent deficiency, you start getting compensation in our bodies. Our bodies will take nutrients from our bones, take it from our muscles, take from our liver. They will start reaping our glycogen stores, our iron stores. It will do whatever it needs to keep the body functioning, especially the autonomic nervous system. So all of this stuff is happening while everyone feels somewhat normal. So then they go into the doctors and they start to get labs. And remember, deficiency precedes dysfunction, and long before labs start to turn abnormal. So once you go in, you're starting to feel, that maybe a little exhausted or tired. You start going in and the labs are all normal. This is the pattern that happens continuously in primary care or traditional medicine. The labs are normal. They're feeling horrible. After a couple years, couple months, they finally go out and they try to find a functional medicine doctor because their primary pathway is not working. They're being failed in traditional medicine because no one's addressing the symptoms or the way they feel. And it's not traditional medicine's fault. It's just there's nothing to diagnose or understand what's going on unless you have some sort of concept in micronutrients or in functional medicine solutions. So once the symptoms start to emerge, this is after our cellular reserves are exhausted. This is at the bottom. And since we don't have proper lab testing, this is where disease is already set in. And as you know, once disease has happened and once you have cellular disruption, it's a lot harder to get out of the hole. So function medicine becomes a starting point. And you're going to see this, if you've been doing functional medicine a long time, you've already seen it. If you're getting into it, this is where you're going to start collecting new patients. It's because when traditional medicine fails, eventually they know somebody or they've read something or social media has told them, hey, you might want to go see someone that's looking at your health a little bit differently from a different perspective and see if they can help. And then down at the bottom, you hear it says, disease is often the final chapter of a long story of deficiency. That is exactly right. So that means most chronic disease is preventable. So if we understand that this trajectory has been in place, we've seen it unfold. We understand that micronutrients are the main substrate or the main cause of deficiency, causing mitochondrial disruption. That means that we can make changes right now and start preventing disease before it happens. Because once people are sick, once they're on medicines, once they're into the traditional healthcare ecosystem with a lot of different doctors with their hands in their pot, especially antidepressants, once you get into mental health, it is a lot harder to make a difference and start making improvements in people's lives when they're farther along in disease. So what are the root causes? Root cause of deficiencies are pretty common. I'm going to go through this quick. Soil depletion, modern agriculture. We all know this. If you don't know this, you need to pay attention because this is very common. The ultra processing of the foods. This is disappointing. I challenge anybody to start going, whether it's Whole Foods, any of your healthy grocery stores, for the most part, anywhere. You can be in the airport, anywhere you go, pick up a package and just read the back of it and try to find food packages that's not in a special section of healthy foods that don't have bioengineered foods in them. So you can see the ultra processing, the reaping of our nutrients, the lack of regulations, putting constituents or engineered foods into our packaged goods. It's causing this issue that we're having where we're seeing more and more absorption issues, gut dysfunction. There's tons of people being treated on various prescription drugs. These prescription drugs have direct depleting characteristics, like for instance the statins and CoQ10, proton pump inhibitors, and magnesium and zinc and B12. Oral contraceptive pills. I mean, zinc, magnesium, CoQ10. B12. I mean, so some of the top prescribed drugs are also contributing to some of the top deficiencies that we have. And so you're kind of seeing this picture unfold here. And so chronic stress, again, chronic stress causes disruption of our mitochondria. It uses up all of our nutrients, especially our B vitamins. Certain diets, vegan, vegetarian, you're missing iron, you're missing B12, you're missing zinc, and then GLPs, you're getting, we're starting to see people with both micro and macronutrient deficiencies because they're just not eating. They can't. And that's worsening, some of the side effects of these drugs and actually contributing to the GLPs not working in some people. And then we have genetics. You have things like the MTHFR defect, which affects folate and B12, and the COMT, which is with dopamine and some of the B vitamins. So there are a lot of different ways that we can get to micronutrient deficiencies, but you can see some of them are ubiquitous. I mean, these are everybody's being affected by them. So many people are on statins, so many people are on proton pump inhibitors. And remember, a lot of the gut issues that we're having comes from stress and it isn't high acid. So they're putting people on these prescription drugs to lower acid, and it's actually a low acid environment. And so what's happening is that things like SIBO and which is a small intestine bacterial overgrowth, these conditions are creating low acidic environment. And in what we're doing is worsening it by adding some of these drugs in there. And it's again, these are opportunities for us to make changes as we get these clients coming in that have failed in traditional medicine. So here are some of the top common deficiencies, and these are pretty much going across the board. When we talk about micronutrient deficiencies, these are the ones that are driving the problem. Magnesium is the number one deficiency. It's very close. I mean, I think vitamin D3 is another one that's, I mean, almost everybody that we see come in our office is low in vitamin D, especially sick ones. They're all, under 30, sometimes even under 20. Iron and ferritin is becoming a new major deficiency. We always knew that iron was a common deficiency in women, especially menstruating women, but we're starting to see iron deficiency, across both genders. And just remember, ferritin is usually can either go up with as an acute phase reactant with inflammation, but ferritin is a better lab for iron stores, usually dropping before iron does in serum. Omega-3s is another one that we're getting. Basically, it's ratioed out by consuming too many omega-6s. And the B comp, all the B vitamins are used up in our stress response. Glutathione's our main antioxidant, and NAC is a precursor to that. And as you can imagine, again, we're talking a lot of this is we have too much inflammation. Too much inflammation causes us to use up all of our resources, glutathione and NAC being one of them. Just an example of NAC was during COVID. You have this new virus that a lot of people haven't been exposed to. You have this huge immune response, all of our resources being used up, and then all of a sudden they take NAC off the market. That's because it's a precursor to glutathione. Glutathione was being consumed, and they were finding that NAC supplementation was actually improving outcomes. Well, of course, it's because we are using up all of our glutathione trying to counteract the infection and the viral syndrome. And but it shows that these therapies work. Vitamin D is necessary for the production of testosterone. So these common deficiencies have consequences, but so you can also see if these are the most common deficiencies, replenishing them can't be that hard. So how they present clinically, this is pretty common. I mean, everything you can imagine: fatigue, anxiety, hair loss, brittle nails, low libido, erectile dysfunction, GI dysfunction. This is micronutrients. Basically, all of this, is in some form in disease. And when we look at it, and then, again, hidden hunger is the consumption of calories without the nutrients, and that is where we're at in the United States. But when you put this to what's the next slide here? Okay, yeah. So when you think about this, the common diseases linked to nutrient deficiencies, it becomes very easy. We talked about thyroid. If you look at the symptoms, you can see these common diseases that are all linked to nutrient deficiencies, but they're never treated that way. But all of these conditions in functional medicine, just remember, when someone comes to us with any of these conditions, do we look at pharmaceuticals first? Absolutely not. So just realize that when we sit there and these patients come in, we first start to look at what can we do to improve thyroid or hormones, metabolic disease, like cardiometabolic disease. That's going to be zinc and magnesium. These are deficiencies that we know are there, but the symptoms aren't there. And then once they do have symptoms, high blood pressure, myocardial infarctions, any sort of angina, cognitive decline, mood disorders, mental illness, all the autoimmune conditions, all of these things have a micronutrient base to it. And I could go through them all and talk about all the micronutrients, but again, I want to leave some time to talking about the replenishing and treatment options and then questions. But you're going to see in the functional medicine side of things, this is how they present to us. I'm always tired. I'm just nothing. No one's been able to figure out why I'm always so tired. The stress burned out patient, the always sick patient with immune dysfunction, the GLP-1 burnout. They've been on GLP-1s, they were doing great, and now they just can't move. They can't get out of bed. They've plateaued. The HRT/TRT patient that plateaus. Psychedelic non-responders. These are people that come in and they just don't seem to be getting the same type of response from psychedelic therapy. No interest, can't get it up. So the people with libido and erectile dysfunction, and then athlete recurrent injuries. These are all have a micronutrient component to it. And all of these are how the patients present in a functional medicine clinic. They're not coming in saying, I have all these diseases, and they don't want to have diagnostics or diagnoses. They want to just feel better. And so it doesn't matter how they present, the answer is the same, is that we have to figure out what micronutrient they're deficient in, and try to get a response or a result. So how does micronutrients fit into longevity medicine? So when we talk about optimizing, we're talking about immune modulation, autophagy, which is getting rid of old bad cells, and then improving some of these advanced therapies that we have so that we can improve lean muscle mass, reduce body fat, improve circadian rhythms, improve lean, or get people to live, feel healthy and happy, and bring that vitality back. So when we talk about these advanced therapies, they can never overcome a deficient cellular environment. And so again, when we were talking about peptides in the last webinar, or we're talking about GLPs, or we're talking about HRT, TRT, there are a lot of patients that come in and they don't have the same response that we would expect compared to other clients. And instead of changing their hormones, just always thinking, hey, let's go up a little bit higher on their testosterone or their progesterone or on their estrogen or adding some other components in there, we have to consider micronutrients. And remember, we can't rely on labs always because the labs were not created for functional medicine and they don't always give a great picture of a current acute setting for micronutrient deficiency. So we have to listen to our clients and we really have to understand where these problems started, when they started, and what they're related to. Look at their lifestyle so we can get a better in their diet, including diet, sleep, diet, and exercise, so we can get a better idea of what micronutrients might or where their problem is occurring. Is it just mitochondrial? Is it, are they having symptoms of thyroid dysfunction? Are they having issues with blood flow, circulation, those types of things? All of them could have a micronutrient base to them. So also when you look at deficiencies, increased side effects, non-response, and patient frustration, again, when we initially started in functional medicine, we almost had everybody on some form of nutrient injection or IV therapy. It was, well, for one, there wasn't as many peptides, which I will say, but all of these people felt better. When you add the micronutrient component to it, you're removing a lot of the guesswork. So it's going to decrease the side effects, it's going to improve the response, and it's going to reduce patient frustration. So by doing this, you're going to get a better product. It's good for business sense and it's good for clinical outcomes. I go back and I look at when we worked with a company called Fibro and Fatigue Centers of America out of Texas, and this was in between 2007 and 2010, 2012, and this company only worked with fibromyalgia and chronic fatigue clients. And what I can tell you is that our main treatment modality was micronutrient correction, and we did it super aggressively. So you're taking some women, mostly women, 90% female, that were paying a lot of money to this company to get relief from fibromyalgia. A lot of them had bring suitcases of records in. They've seen not hundreds. Had hundreds of doctor visits, seeing multiple doctors, and main therapy was nutrient correction. We did high dose. Yes, we did do some hormone therapy. Yes, we did do, there was a little bit of peptide, but not really. Most of it was growth hormone back then. But just correcting the micronutrients changed these women's lives. These people would, even if they didn't have to have an in-person visit, and some people would drive 3 hours because back then there were no IV therapy centers. This was IV therapy, micronutrient IV therapy was new. So when we had these ladies driving in 3 to 4 hours, even when they could do a phone consultation just to check in, they were coming just to sit and get two super high dose nutrient infusions. And guess what would happen? They would leave, they would go home, and they would say, oh my gosh, after I get these IVs, I feel so much better for 1 to 2 weeks. 1 to 2 weeks of improvement. These are people that have felt their worst. I mean, going to doctor to doctor to doctor and just correcting micronutrients put them in a state of improved immune response, reducing histamines, improving hormone, improving sleep, improving mood, just being able to get out of the room, get out of their bed, get out of their house for a little while. So again, functional medicine succeeds when biology is supported in the correct order. So we have to do micronutrient corrections first, and that's going to make all of these other therapies work so much better. So testing, this is a really important one and a very confusing one, and we get asked this all the time. And so when labs help, when they mislead, and how to test intelligently. So when we look at the labs that we currently have, serum lab testing, they're the easiest, they're the cheapest, they're the fastest, and they're still going to be the gold standard because we can get them. It doesn't mean that they're super helpful. I mean, and we're watching. I hope everybody else there has seen what we've seen, but lab values are changing. They've been changing over the last 20 years, but they keep changing. The normal ranges keep changing, especially in the areas where we used to be able to treat within normal ranges. I'm not sure if you guys have been watching this, but pregnenolone, DHEA, testosterone, even cholesterol panels, hormone panels, all of these normal ranges have been changing all of a sudden. And if you look at it, it's changing the way not into benefit functional medicine. It's actually to make it more difficult because now we used to be able to treat in normal range and actually stay in normal range. So, for instance, if we were giving someone testosterone or T3 or B vitamins, DHEA, pregnenolone, we could treat them and they would come back. And yes, we increased by 50% or 100%, but they're still in normal range. So they come back and they're feeling great, but they're still in normal range. Now you can imagine if lab testing's ranges change and people come back and we are treating them and they go, "Oh my gosh, why does it say it's high? Why is my DHEA high? Why is my pregnenolone high? Why is my thyroid high? My primary care doctor told me to stop my B12. They told me to my cholesterol's horrible." All of these things are happening because they're changing the lab data because lab data is made for traditional medicine to provide pharmaceuticals, not to help them get off of medicines or actually help us find out which micronutrients that we could support and which hormones that we can support. So yes, serum is still great, but it's not perfect by any means, and it definitely doesn't help. We only have certain choices with micronutrients. We can get B12, calcium, magnesium, folate. We can add a few micronutrients on there, but vitamin D3. But again, remember, they're not giving us the big picture. And most of the time, when serum labs are low, the problem is already way, way, way developed. And again, yes, that's great, and we can start testing, but usually we can see by when people walk in, we can see that they have eczema, psoriasis, they have, their hair is falling out, they're overweight. They come, you can see a lot of these outward expressions of disease, and sometimes it's even before their serum markers change. So red blood cell nutrient testing is good. It's good for magnesium, zinc, copper, especially magnesium. And magnesium is a huge one. Remember, it's one of the number one deficiencies. And if you do a magnesium RBC, sometimes the magnesium levels in the serum come back normal, but they have every symptom. They have, cardiovascular disease. They have fasciculations, palpitations. It just something seems off. And you go ahead and do a magnesium RBC, and sure enough, it comes back low, and you can start aggressively replenishing. But it's not for, and again, RBCs are not great for a lot of different nutrients as well, just better for some. Saliva is really, really not good for micronutrients at all. Where saliva is going to come in is going to be for cortisol rhythm, and especially women that are menstruating for hormone testing. But it's not a really good one for micronutrient. Functional markers, what we're talking about there, homocysteine is a good one. Iron, ferritin, some of the other, functional markers, which are good and actually can be better than serum markers because when you find some of the lactate dehydrogenase, some of these can indicate something going on at a higher level, which again, we understand that the micronutrients like for mitochondrial dysfunction or for homocysteine, we know it's going to be something with B12 or folate. Advanced micronutrient panels, we've done this for a long time. There are a lot of boutique labs out there. You can spend a lot of money and wait a long time, 4 to 6 weeks to give some of these results back. These panels are just not, they just haven't brought the reward that we would hoped over the years to the point where we don't use them very often. And I'm going to explain why in the next talking point. But these labs are not governed. We don't know if their lab values or their responses are really accurate. Like I said, we spend a lot of money. We send these labs off. We get a report back. 6 weeks later, these people have we've already started treatment or they've moved on. So it's not really conducive for people that want immediate gratification. So we don't do a lot of these advanced micronutrient testing panels. We will do it for some, especially the ones that want to pay the money. They want to be a little bit academic and try to tailor their treatment regimens to their deficiencies, but it has its gaps and it's not as easy as one would think. The other part of it is sometimes you're going to get people, doctors that are spending $5,000 on labs. The labs come back to the client and they will literally come in and tell us that these doctors spent all this money on labs. And when they brought the labs in, the doctor didn't even look at them. It was, you can obviously see that the provider was making money off the labs. They weren't using the labs to guide treatment. And you got to be careful about that too. We're not, as providers, we try not to make money off of labs. The government doesn't like us making money off of labs. And I think sometimes people can do that, order too many lab panels when they really aren't expecting to get back as much data as they have, and they're not prepared to actually educate their client with those test results. So just order tests based on what you need, but remember, be careful because a lot of them don't give us the data that we really need. So this comes down to treating without testing. This has become the gold standard in functional medicine, and that's because of everything we just talked about. There is no reliable testing. People will talk about urine test and using the Dutch test, will saliva test, some of these boutique labs. You can use them if you want, but remember, people have limited resources. We already have a cash-based business, so people are coming in and they're going to be paying cash anyway. If we have them go run a bunch of tests and then ask them to pay for the treatments, we have to look and say, what can we do without spending a bunch of our clients' money on testing unless we darn well know what we're going to do with the test results? That's why I say you don't do testing unless you're going to do something with the responses. So most of the time, we are treating our clients without lab testing, and that's the predominant approach that we have. We only use testing when someone has a severe symptom, presents with severe symptoms. They have a long-standing uh, uh, um, a relationship with us to where we are slowly, methodically figuring out what their problems are. And some of that is going to require some advanced testing or looking at tests. But a lot of times in functional medicine, we also, triage these patients to a higher level of care if it's starting to get out of our functional medicine hands. Because remember, we can't help everyone that already has underlying disease. Sometimes we do have to let traditional medicine, because of medical legal issues, follow through with with traditional management. But so hopefully that makes sense that trial with micronutrients is not an aggressive or risky approach. So if you can imagine, after listening to all this, you can see how micronutrients, specifically a handful of micronutrients that are deficient, dominate a lot of the disease. So if we know that most of these nutrients that we're deficient in, and it's kind of ubiquitous, and people are coming in with disease, we have to assume that if we correct those deficiencies, especially when most of them are water soluble, there isn't a big problem with that. We're not, the risk is very, very, very low. These nutrients don't become toxic. We're replenishing with some common sense. And so, so starting someone out that has symptoms that you're pretty confident can be corrected with micronutrients, and potentially eventually HRT, TRT, or peptides, then just start them out, get them going, start them out with some IVs or oral IVs, IM. But getting them going on micronutrients is likely going to cause a result. It just questions how quickly that result would be, and that comes down to how we replenish. So when we're talking about the treatment roadmap, the correction hierarchy is pretty simple. Food is the foundation. That's never going to change. Well, I shouldn't say never. With the way our society is going, we might end up eating some paste full, nutrients dense paste at some point. I hope that doesn't happen. But anyway, the correct hierarchy is food sources, and that's when we start to go beyond food sources to oral supplementation and then IV and IM strategies. But so for food sources, you have to understand this is what our gut understands. This is what feeds our microbiome. Our microbiome is what it's the second brain of the body. Our body runs on whole foods, on regular food that we can digest. That's what it's always been based off of. It knows how to break it down. It knows how to use it. And if we eat a balanced diet with good macronutrients and micronutrient dense foods, people do pretty darn well. But we have to understand that we cannot put ourselves into a stable micronutrient state in this day and age of food processing. It's almost impossible for us to get the right amount of micronutrients. And so I tell people it's that we're not in a position to supplement our good diet. We have to require a certain amount of micronutrients in our diet to actually make our bodies function the way they're supposed to. So, and you just have to understand that you cannot expect anybody that comes in your office that they're not going to have some form of micronutrient deficiency. You just have to assume it safely. And so when we talk about oral options, there are oral options that can be helpful. We tell a lot of people start with Celtic salt, Himalayan salt. It has a high amount of nutrients in it, but that is not going to correct deficiencies, especially ones that are starting to show symptoms. That is going to help with hydration and electrolytes. Huge for the body, huge for day-to-day operations, will make a profound effect for some people by just adding a little bit of Celtic salt in the morning and at night. A pinch, put some in the water, but it's not going to change these deep foundational micronutrient deficiencies that we're talking about. There's a great supplement called Six Daily. We use it in our office. There's other good oral multivitamins, but this one's really good. It's you take six a day. It's under $40 a month. We push all of our clients towards it. It's lacking copper, omega-3 fatty acids, and calcium. But it does have a good amount of micronutrients on it. It has, and they're in the methylated form. It has vitamin D3, it has vitamin K2, it has boron, has other minerals in it that are nice. But some of the ones that we really push on a maintenance level. So again, remember, food is the foundation. Oral supplementations are good for maintenance and balance. But again, if you have patients that have disease, if you have patients that have plateaued, you're going to have to get more aggressive. And this is the meat and potatoes of this whole conversation is that we're functional medicine providers. We have solutions and we are good at providing solutions when it comes to micronutrients. We just can't ignore them. So remember, when we start getting into, when we're beyond oral and we're beyond the food, and we have people that we're really trying to make an impact on, or they have disease, they're coming to us with fibromyalgia or some fatigue syndrome, or just not getting what they needed from traditional medicine, pull out the IVs and pull out the injections. And this is the part that, again, my office is going to get back to being a little bit more aggressive on, is because this was the foundation that we started on. We had almost everybody on some form of IM injection. Almost everybody, either on B12 by itself or some mix. We had an energy mix. We had the Calm that had zinc and taurine and magnesium and GABA. Some of these things aren't available anymore, but we were using injections all day, every day. And the IVs, I mean, yes, IV therapy is saturated now. Back when we were getting started, there were no IV centers. Now they're everywhere, but they're everywhere for a reason. And we can't take that out of our offices just because there's competition. If they're in your office and they need an IV, you have to be confident to tell them, hey, we cannot forget micronutrients. And people love IVs. Back in the day when we were, anybody that came in for an IV, almost 100% of them would be back. And you know why? It wasn't because they like a needle stuck in their arm. They were coming back because they felt better. And remember the fibromyalgia clinics that we worked with. These people were driving 3 to 4 hours for these IVs. I've done a ton of IVs. I've done a ton of injections. These things work and they set the stage for you to get better response out of your other advanced therapies. All I have to think about and talk about is GLP-1s because, when you get these clients coming in, you have to assume that they're going to be undercaloric and they're going to be micronutrient deficient, all of them. Most of them are going to be macronutrient deficient as well. So if you don't identify that and start that foundation out by getting them on some sort of correction, the chances of them having side effects or plateauing or just completely stopping therapy go up tremendously. And it all makes sense. And so you look at some of the other diets and just getting back to the understanding of getting patients in there. You want patients in the IV room. They like being there. When they're in the room, you get to know them better. You get to understand more of what their needs are. It just becomes a really good way to get a good relationship with the clients that are there. And if they can't come in for IVs, if they're too expensive, then just use intramuscular. Get people started on the B complex, the glutathione, alpha lipoic acid, the B12 injections. I mean, when back in 2002, we used to have these ladies that would come in and they were 70 or 80 and they were still going in once a month to get their cyanocobalamin injections from their primary care doctor. And they would tell us, after I get my injection, I feel so great. This was back in 2002. And now here we are, and I rarely hear functional medicine doctors talking about nutrient injections or nutrient IVs anymore. All they're talking about are these advanced therapies. They're running to what's new and hot. They're getting pushed by demand from social media and their clients, but we can't let them dictate the way we practice medicine and that we know we should practice medicine. So when we say when injections outperform oral, that's pretty much all the time. But there are certain cases where you just can't rely on oral. And I already mentioned them. When you got people plateauing on HRT or some of these eating strategies, or people are trying to lose weight and they're plateauing, they're probably starting to burn out. It makes complete sense. You know, they're trying to lose weight. When you lose weight, you're exercising aggressively. That is a stress. It's a good stress, but it is a stress on the body. And when you're not bringing in the nutrients, you're burning through the nutrients faster. You put yourself in a negative. You start pulling from sympathetic tone again. These women start getting midriff weight, and men, but you can start to see how this pattern presents itself, and it makes and it's easily preventable. So pull out the injections when you start to get people that are kind of sputtering, or just not getting the responses that you think. But again, always micronutrients first. You have to take care of the cellular health, and then everything else starts to get better. And just know that not everybody has to go on a peptide. Not everybody has to go on one of the GLP-1 peptides or any of the growth hormone secretagogues. This is just as what hot is hot. And these people are coming in saying they want these things. But remember, if you have an unhealthy patient that wants some of these advanced therapies, if you're not careful, what will happen is you'll get these people on these things and they'll just disappear. Because guess what? If they're spending money with you and then they're like 3 months later, they're just like, oh, I didn't really feel anything. They probably just won't show back up. They're like, ah, didn't work. I'm not going to spend any money there. But you could have prevented that had you understood that there were likely several micronutrient deficiencies that were causing them not to get the result that you were expecting with one of those advanced therapies. So just get back to the basics, correct the micronutrients first, and then start moving on to these other therapies because most people have the micronutrient deficiencies in the first place. So I got through that very quickly because I wanted to make sure that I had some time oh, perfect. And we do have a little bit of time here. So, anybody have any questions before? And then if anyone wants to hear more about my practice, trainings, and some other things, just hold on. But let's at least see if anyone has any specific questions about micronutrients because I did talk very, very fast.
Please feel free to unmute yourself. You can ask anything out loud, or of course, you can always ask it in the chat.
Anyone?
Dr. Aiken, I am curious if you guys have a favorite micronutrient injection that can be done at home.
Well, all of them can be. That's
Okay.
the nice thing. But my favorite is still going to be B12, B12, B complex, glutathione. Those are,
Okay.
yeah. I mean, B12 alone, for anybody, especially especially in today's age of stress and fast-paced society, we're just burning through our Bs. Our B vitamins are just, you just have had so many patients that you get on B12. I just started my mom on them again, thanks to these webinars. I had forgotten, I can't keep track of everyone, and my mom had not been on B12. She's 80, and I just got her started back on it, and she's doing great. She's doing better, and I hate to just say it's B12, but it's kind of time coincidence. So, it is neat, and you can go really high on B12. The methylated form, when we started out, we were doing 1,000 micrograms, once, 3 times a week. We're up to 2,500 to 5,000 micrograms 2 to 3 times a week, and you can start really seeing some improvements. And remember, other countries go way more aggressive on B12 administration and replenishing. Some countries have this huge protocols for neurodegenerative disease. So you can push the B12. You always, whenever you use NAD, or B12, remember you need the other B vitamins with it. So if you're going to do B12 or NAD, make sure you have either oral replenishing of the other B vitamins, or also in an injection. But those are my starting ones. And some of the there used to be some really good ones. They had some that that had ribose and L-carnitine and ATP. I mean, we can't get that anymore, but some of these nutrient injections were phenomenal for energy, but we don't have the same opportunities because the government has called them biologics, and as you know, removed some of the nutrients from our ability to acquire.
Right. So have you guys made any advances in the glutathione coming up as a sub-Q injection, or is it still IM?
Well, it's still IM, but they are coming out with some nano liposomal therapies for
Okay.
glutathione to very likely be back in an oral form that actually is useful. There are a
Okay.
lot of the glutathione oral supplements out there. They're very expensive. And we get clients that try them and just don't get a response. You give them the injection, they feel better the next day. So just
Mm.
remember bioavailability and our gut environment definitely is going to factor in on how people respond to these therapies.
Yes, absolutely. And you recommend whole food B complex then for an oral supplement,
Which one?
like a whole food based
Oh yeah,
instead
yeah,
of
yeah, yeah. Food,
okay,
yeah,
yeah.
yeah, yeah. Obviously, anything you can do with the foods that are going to be nutrient dense, animal
Mhm.
products, and then green leafy vegetables for magnesium and zinc and and uh, and iron.
Perfect. Yeah. I love that you said B12. That's my favorite.
Oh yeah, it's the
Clients do
best.
great. I'm like, do you live a stressful life? Then you're burning through your B12. And do
Yeah,
you consider therapeutic levels to be over 2000?
of course.
Okay.
Yeah, yeah, absolutely.
Anything under a thousand,
As high as they
anything
can
under a
get.
thousand is deficient.
Say that again.
Is anything under a thousand considered deficient?
Yeah, in our book, but when we start seeing levels coming in between two and 400, we push really, really hard, especially if people have disease.
Right.
But yeah, and just remember, remember B12, when you get a higher dose injection, you're talking a diabetic needle. 25 units can get you 2,500 micrograms. You can really get a lot of methylated B12 with a small injection. So it's not really intimidating either.
Perfect. Okay. Thank you.
You're welcome.
Dr. Agan, what do you guys use for the calm now? I know we used to be able to get it, but I can't find anything anywhere.
Yeah, it's pretty much obsolete now. We're hoping that, sometime in the near future, GABA will be back, but we usually just try to do IVs where we can put at least some trace minerals in there, because if you use trace minerals in an injection, it can burn. So, you are a little bit limited, but so you're going to have to stick to oral replenishing or trying to get people in for IV therapy.
Right. Okay,
And you
thank
still can't get GABA.
Right, I
So
was just gonna say I can't put anything in the IV really except for some of the other ones, but nothing that used to be in that
yeah, I
com.
think you can still get taurine infused. Yeah, you can
Yes.
still get taurine. So taurine, magnesium, and I think yeah, you can't get GABA. Yes, so taurine, theanine, and magnesium you can, but you can't get the GABA.
Right. Okay, thank you.
Absolutely.
Question for you. I'm just starting out kind of a medical spa with a little more focus on peptides and IV infusions and a little more health focus. But I know what I'm getting when I start to teach this to my clients. I know the questions are going to be, yes, we have, soil overprocessing, bioavailability problems, but what diet should we try to function with day to day? Should we stick to an anti-inflammatory diet? What kind of eating
Well,
habits do you really encourage?
yeah, I like anti-inflammatory, but you're going to start seeing that more and more people are talking about a balanced diet. You hear people talking about OMAD, where they're maximizing fasting and they're trying to utilize the benefits of fasting, but also getting a one balanced meal in where they get their breakdown of their calories, carbs, and protein is exact. And there are some really good data on that. But any eating strategy is good, but when you're looking at an anti-inflammatory, you just have to be careful because some people go on an alkaline, which is going to be more vegetarian or vegan. But an anti-inflammatory I like if people are doing it right. You just have to make sure that they understand what that balance is going to be, so they're getting the balance of the macronutrients. Because all of the as I said in the presentation, is that some of these diets are what's causing the micronutrient depletions. Because sometimes even when you're not getting the macronutrients you need due to dietary restriction, it affects the micronutrients because it changes the environment. Remember, our bodies compensate to try to make the body work the way it's supposed to. So if you're not getting enough macronutrients in, the body's going to start causing compensation, which they're going to start taking some of these necessary nutrients from other areas of the body. And so you really have to kind of have your head wrap around all of the eating programs, because you're going to get them all coming in with different strategies. We like intermittent fasting, just because it's a real easy one. And I always tell people when they ask me if you have suggestions, like, if you had one thing to tell someone to do that could impact their health, what would it be? And intermittent fasting is one of them. Because to me, if you get the benefits of fasting, you get the benefits of autophagy, you get some of the appetite control because of fasting. And, it also limits your caloric intake because you're getting all your calories in an 8-hour window. So it really is a really neat way, especially if in that window of intermittent fasting, you can also just preach. You need the balance of your nutrients. And then that's where functional medicine comes in, that when you're eating this way, again, because remember, we're an over-caloric intake environment. We do not need nearly the amount of calories that we're taking in on a daily basis. So again, it's impossible to get the amount of micronutrients we need in a depleted food environment where we're taking in too many calories in an obese society. So this kind of fits right into functional medicine. Pick an eating strategy, whether it be one meal a day, carnivore, intermittent fasting, Mediterranean, vegan, veg, it doesn't matter. Get on that diet, get your calories set so that you feel good, and then let us support your micronutrients with oral options, and then come in for IVs. I have patients that have come in once a week for an IV for 8 years. I have patients that have been doing nutrient injections for 15, 20 years. So that's why I was excited about this, is because it really did reinvigorate my attention on micronutrients. So I think if you can provide that to them and saying, hey, let's just find an eating strategy that's going to work for you. And once they have that eating strategy down, and their calories seem to be good, you just have to surround it with a good micronutrient replenishing program. And that's how functional medicine makes money, in the right way. Give them home injections, and they're just order them month after month. They're just ordering at home. When they have time to come in for a visit, they sit for an IV. If you have patients that are a little bit sicker, when they're coming in, they're already a little bit behind where you want them to be. Tell them to do a series of IV for the first 2 months while they meet you. That is going to make the biggest impact. Again, if I'm trying to give tips to you guys to have success, to where these people go and go, oh my gosh, I already feel better. We always started with micronutrients. Everybody that came in almost got IVs. And guess what? They felt better. So we immediately made an impact, because hormones and peptides can take 3 weeks, 6 weeks, 12 weeks before they start feeling good. But you give someone a micronutrient IV, just like I said, you give them an IV that's never had one, chances are they're going to be coming back because they just feel better. So if you get them started on the micronutrients at the beginning, you get them on an eating strategy, you start getting their lab panels back, the HRT, TRT peptides start happening, you're going to get this nice transition of people where they feel good and they continue to start feeling better and better with the other modalities coming after the micronutrient correction and after the dietary planning, if that makes sense. You're on mute. You're on mute.
I know that was great. Thank you for that. But I've decided to turn this into a mobile service.
Oh,
So
perfect.
going to people's home doing peptides, I had to classify my business as a home health care because I'm carrying medications in my car and going to people's homes. But my concern is, there's new federal regulations about compounding for me mixing my vitamins into my micronutrients into my IVs. Are these pharmacies that are compounding? Are they able to do a mix that you specify for the patient?
Yeah,
Or
I mean, what state do you live in?
Florida, right with you. I'm
Florida?
here in
Oh yeah,
Clearwater.
yeah. Yeah, so there should be no regulate. You don't need to use sterile technique when mixing IV bags in
Okay.
Florida. Most states you don't. So what they do say is that you're supposed to, when you mix an IV bag, you're supposed to use it within 4 hours.
Okay.
That's not a hard set, you know,
Yeah.
if they came into your office, that's what they're going to tell you. If you have IV bags like with a label on it saying 2 days earlier,
Yeah.
that's not what they want you to do. They want you to mix the bags in the morning, use them
Okay.
within 4 hours, and then but so what you're going to find on the compounding side is there's going to be like Liquid IV has some good mixes that you can buy that you can basically inject the whole vial into the bag to create the IV.
Okay.
Um, they're still not optimal because you can make bags with higher amounts of each of the nutrients.
Mhm.
So you can mix those bags at home, but if you're a mobile unit and you're mixing these just to get to your clients, it
Mhm.
is a little bit different. You might want to start looking into Liquid IV just because
Okay.
having all these vials at your house and having beyond use dates and expirations, it
Yeah.
might get hard for you to use them all in a mobile setting. But I think the
Yeah.
mobile setting's brilliant. I think you're going to be highly successful. And we should talk
Thank
again
you.
because after this because we're working on a mobile program that involves everything you're talking about, and adding in psychedelics into it too. So,
Okay.
but yeah,
Well,
I think if
I'd love
you
to work with you guys on it because I'm doing Bel Air, Clearwater Beach, my hometown, and
beautiful,
I think Sand Key and Island Estates. But um, the this, like you were mentioning, the stability of those meds. I don't think I should have a problem because I can deliver here pretty quickly. But I did have to have an office, a home base, so
yeah.
I will
And you
be
know what else
mixing.
you could do is we could talk about is if you get kind of a partnership with a functional medicine clinic,
I would
you
love
could
that.
also pick up the IVs from a functional medicine clinic that
Yeah,
does them all day, and then you
right.
don't even have to hold inventory.
I would love that because I had to get a medical director, and unfortunately, he's not real well versed in integrative med. I think he's an ER doc.
Mhm.
So very late, down the road thinking, but I would love to find someone local here, to take over
Yeah,
as my director.
talk to us about it. We might be able to work
Okay,
something out with you so that it can make it easier on the IV bag part of it.
sure. And the peptides.
Yes.
Okay, great. Thank you.
Hmm.
Hello, doctor. I have a question for you.
Sure.
So on the growth factors that you're talking about, like the NAD, the glutathione, what is your stance on, since they are human growth peptides, people that have had cancer before, and then also on the insulin growth factor lab test, are you for that, against it? You don't think it matters? If you do think it matters, what are the values that you believe are safe?
So we'll start with the first one. So on the growth hormone secretagogues, for people that had a history of cancer, initially, I mean, I'm talking back in the early 2000s, we were a little bit legal worried about putting people on growth hormone secretagogues. We're not now anymore.
Okay.
Especially not at all. When you look at
I
especially
am a
how
cancer survivor and I was taking NAD, so that's why I'm asking.
Yeah. So
Yes.
NAD is just a nutrient byproduct of niacin, so you can take that all day long. That is a never going
Awesome.
to be an issue. But
Okay, good deal.
the growth hormone secretagogues, you got to think the way these things work is they're potentiating your own pituitary to make and secrete growth hormone. And
Yes,
so
sir.
they're not adding exogenous growth hormone, which was the initial scare about growth hormone
Okay.
was like, oh, growth hormone is going to come in and cause cells to the cancer to
Proliferate.
grow. Yeah, exactly.
Okay.
That's not how cellular dysfunction happens. This is, like we said,
Okay.
all of this stuff is happening over time. And to think that you're going to get on, and if you look at all the benefits of growth hormone, that is everything you would need if you're trying to get your body to fight cancer. Um,
Okay.
so, so I think the
That
safe way,
sounds right.
yeah, the safe route would be is to use the secretagogues, not use human growth hormone. But
Okay.
yeah. So you can definitely use those. And then your other question was about what was the last one?
I'm do what? Insulin. It was about
Oh,
the
IGF-1.
testing for the IGF-1. Yes. And I have not found any values that would even tell my prescribers what is okay and what's not. But with what you are saying, it is irrelevant.
Yeah. We
Right.
use IGF levels, but remember there's six binding proteins that bind
Yes, sir.
IGF-1. So, you can even test the IGF binding proteins. You can test IGF binding protein 3, which I think is the #1 binder. So you can see how complicated this gets. So just getting a snapshot of
I
IGF.
do.
Yeah. So
As a chief operating officer, we have gotten into deep water.
yeah.
Yes, yes.
Yeah. So if you're I add IGF-1 onto our panels,
Okay.
and
Okay.
and people that come
Is
under
that for
100.
defensibility,
What's that?
or is that for defensibility, or
No, it's still, like I
okay?
said, if someone comes up with and remember, IGF-1 has a growth hormone, and IGF have a very short half-life. So you're getting a
Okay.
snapshot of that IGF level at that time. But if people come in and they have an IGF level of under 100, chances are they need some help. There's a
Okay.
definitive opportunity to help. Now, if someone comes in with an IGF of 150, 160, would that cause me not to prescribe a growth hormone secretagogue or IGF-1 LR3? Absolutely not. If people have the
Okay.
symptoms, if they have any sort of complaint of recovery issues, they're not getting the results in the gym, they're having sleep problems, inflammatory problems, I would prescribe a growth hormone secretagogue all day long, even if they have an IGF-1 that was over 100.
Okay. And sorry, my last question also would be, with everything that you're talking about, it seems that certain types of modality or comorbidities like complex post-traumatic stress disorder, panic disorder, things like that, are treated with psychotropic medication that does not work. I'm just going to say that from personal experience. The micronutrients can be the answer.
Absolutely. Yeah, because
Okay.
remember the pattern that we're talking about. It starts with this whole slow trajectory of disease. And when you get
Yes.
cellular dysfunction, one of the first things that happens is you get cellular signaling loss. So now the neurotransmitter formation is one loss. You start getting gut dysmobility. You start getting
Hmm.
different changes in your gut. And remember, the gut is 90% of your serotonin and most of your dopamine. So
Yes.
all of absolutely, anxiety and depression medicines are symptoms. They're not diseases, and this is
Right.
well established. And so that's why I say again, remember all these fibromyalgia patients we treated, almost all of them had depression or anxiety because they've been sick for 2 years, 5 years, 7 years.
Right.
They're all on antidepressants. You start getting their micronutrients corrected, get their hormones balanced, start getting them exercising and changing their lifestyle, they slowly pull themselves out of it. But remember, micronutrients was the key #1 modality that we used on every one of those patients.
Okay.
TRT, HRT, and peptides came after, sometimes 2 to 3 months after the micronutrient correction.
And so after this, you will be online you have courses and things like that prescribers can come and take, correct?
Yeah. They'll
Okay.
talk a little bit about how our whole system works and everything.
Okay,
But
great.
yeah, and if you have any other
Awesome.
questions that you remember, just email them to us.
Absolutely. Thank you so much, sir.
You're welcome. Any other questions? That it? All right, Casey. I think that's a wrap.
All right. And then I think Shelley was just going to do those last few slides.
Yep. All right, everybody. I'll let you all go. Thank you
Thank you
for
so much.
being here.
Thank
Thank
you.
you, guys. All righty.
Oh,
So I think the slides disappeared.
all right. Let me just put them back up there.
Otherwise, we can go get them. But.
No, I'll put it back up there. Sorry.
Okay. So we kind of have two different opportunities for you. One is our training. And I know, Sarah, you mentioned that. So we have 5 different trainings right now. And we're actually offering 6 months medical support and the platform for free with the purchase of our training. So we can send you more information on that, but we have peptides, nutrient IV, sexual health, weight loss, and we have, I don't have the slide up, so I'm trying to draw a blank.
Sexual rejuvenation. Did you say sexual rejuvenation?
Sexual rejuvenation. So those are our trainings. They're virtual. So they come with a slide deck and then the video of Dr. Agan talking. You can kind of stop and go as you want, and it'll pick right back up. And then you can call us with questions. You actually get our ordering platform, which is an online ordering ERX, DEA certified, so you can order controls right through our platform. You'll also be able to have, again, that 6 months medical support. So as you're placing your orders and you have questions on dosing, you'll be able to reach out to our medical team for help. Casey and I are always here for just the general questions, training, helping you source your products. So let's say you're having a hard time getting a certain product. We have 17 pharmacies on our platform. So our goal is that you'll never have to leave the platform in order to place orders. Now, we're not there yet, Sarah, but we're close.
And then you guys help with best practices, right? In all of this, since it's so like, I mean, maybe not the micronutrients aren't gray, but a lot of like the peptides are gray. And, I mean, they've just now become available to our prescribers to use. And
Right.
you help us all with that, right? Like,
Yep,
this is red, this is green, this is yellow. Don't do this. You can do this.
Yeah, I'm not sure if we've got the listing, Casey. I haven't looked at the material about if we've got those colored, but we have have you been to the previous webinar where
so I'm just a chief operating officer, so I just like make everything run, but my MD did attend the last webinar, and then he asked me to attend with him today. He was in there, Dr. Hubbard. And so he went to the last one where I guess it was talking about the green, the red, and the yellow on legality. Yep. He said it was very informative. I have not gotten a chance to recap it yet. Today, I also attended because I was taking notes and sending them to our NP as your doctor was talking. Okay. So yes, trying to get everybody on board. They're used to traditional medicine, obviously. Right. And they're wanting to cross over into functional medicine, and I'm trying to help them make that crossover. And so we're utilizing you guys as educational source. So thank you so much.
Yes, absolutely. So one of the great things about our training is that you have access to Dr. Agan. So I think that sets us apart, because you're not just getting this training and then you're out the door and then you're expected to figure it out yourself. Like I think Kathy was on here. She's an excellent resource. She's been with Dr. Agan for 23 years. They have been doing functional medicine the entire time together. So you're really going to get that kind of hand-holding experience where you need it. And then in terms, so I would suggest, if you're interested in the platform as well, if you buy the training, you get the standard platform free. So
can you shoot me? I think that you and I are talking on Facebook. Could you shoot me the pricing?
Absolutely. Yep. Okay. We'll get you that. Right. I'm assuming the email you signed up with is the right email, or do you want it to go?
Yes, that is my email. That is my email. And are you guys located in Waxahachie? Did you guys just have like an open house?
Clearwater, Florida.
Okay. All right. Then it's not you guys, and I did not miss out on anything that mattered to me. Okay. All right. Just making sure. All right. Well, I appreciate it. I look forward to your email.
Absolutely. We'll send that to you today so that you have the pricing. And I know I offered special pricing, so I'll make sure I honor that. If anybody else is interested, just say something in the chat and we will get something going with you as well. But we do have I think Dr. Agan didn't get the slides up, so we don't have them this time, but that's okay. We'll send you all the information and we'll go from there. And if you have any questions, anyone, let us know. You can reach out to Casey or myself, and you can visit www.mypracticeconnect.com, and we have our training listed there as well. All right.
Thank you, ma'am.
All right. Thank you, everyone.